Good morning, and thank you very much for the opportunity to present Sunbury and Cobaw Community Health in Kyneton. My name is Neil Charitra, the Director of NTC Architects. The project was funded through the State Government's Regional Health Infrastructure Fund, which is administered by the Victorian Health Building Authority. It was constructed under a lump sum contract by A.W. Nicholson, a regional contractor based just outside of Ballarat. This project was undertaken for our client, Cobaw Community Health, who have subsequently merged with Sunbury Community Health, and we are very proud of the outcome, as is our client. Our design approach and aspiration for this public building was to create a piece of architecture that has a dialogue with Kyneton District Hospital and the story of the Macedon Shire, and creates spaces that are focused on wellness for the patients and staff. The greenfield site on Tungarung land on the eastern edge of Kyneton, just opposite the off-ramp from the Calder Freeway. The building is located on the corner of Burke Street and Caroline Chisholm Drive, adjacent Kyneton District Hospital, which creates a health precinct for the Shire. The new 1,650 square metre building is designed as the flagship facility for the well-loved and growing health service, and replaces their 30-year-old outdated facility in the centre of town. They provide important community services such as NDIS, youth mental health, housing support, needle exchange, LGBTIQA support services, podiatry, family counselling, and family violence services, to name a few. The brief was quite simple. Create a non-institutional building that has strong ties to place, creates a new identity, is connected to landscape, has high amenity staff spaces, is calming, has intuitive wayfinding, and is universally accessible. The brief feathered nicely into our interest of embedding the core principles of salutogenic design, or the design for wellness, into our projects. These principles are evidence-based and patient-focused, providing spaces that can alleviate stress and anxiety, create an environment of wellness via clear wayfinding, having connections to landscape, daylight-filled spaces, and spaces that are generous and have good acoustics. The building was positioned outside of the existing helicopter flight path and deliberately aligns its eastern edge to this. The pavilions take cues from the arrangements of farm buildings and also allows for a formal dialogue with the adjacent Kyneton District Hospital. The plan is conceived as a collection of pavilions linked together via a welcoming central public space of the reception, waiting, and family spaces. Excuse me. Each pavilion is attributed to a particular function. The staff pavilion, the community pavilion, and consulting. To enter the building, you progress around a large central landscape, either via the stairs or a very gentle brick patterned walkway. Patients are welcomed into a light-filled and quiet central space with sight lines to reception, amenities, waiting, and the flexible community multi-purpose rooms. By having 3 separate buildings allows for a greater extent of windows, and terminating main corridors with windows allows for daylight and views to landscape from all rooms. Shown in blue is the staff pavilion. Providing high amenity staff spaces was a key part of the brief. The staff are a valued part of the organisation, and it is acknowledged that it is a stressful vocation. The staff pavilion provides a distinctive vaulted ceiling, open plan workplace for 80 staff. The vaults allow for excellent acoustics and access to natural light and views to landscape. The arrangement of desks also allows for numerous ways to organise the staff and provides them with amenity of indoor plants as dividers. We have provided several smaller quiet rooms for telehealth and dedicated quiet room for when staff have had a difficult appointment. The community pavilion shown in, to the top there in pink and the adjacent green kitchen provides large, flexible, multi-purpose rooms that allow for different functions, and a large wheelchair accessible kitchen adjacent that can be booked by community members. It's also planned in a way that it can be used after hours. The consulting pavilion to the east has the patient at the forefront of the design, with calm spaces, excellent daylight, and connections to landscape. It provides 11 dedicated consulting rooms, 2 allied health spaces, and youth and paediatric multi-purpose spaces. The interiors establish a simple strategy for each pavilion, attributing themselves to a specific characteristic of the Macedon Shire. That is the Macedon Ranges, Campaspe River, and the environmental Cobaw BioLink project. This allows for a colour and material palette to be developed that links the building to its place and provides for a legibility of clear wayfinding. The dry riverbanks of Campaspe River contributes to the carpet tile pattern, which continues through the brick paving of the external entry landscape. Continuing our interest in creating patterns from non-traditional objects, we have lined the walls of the central public space with an overscaled pattern of insect tracks found on local gum trees, which has then been printed on plywood sheets. The project was conceived in the beautiful autumn colours of the Macedon Ranges, and the brief talks about creating a new identity for the organisation. The distinctive form of the arch takes cues from the local vernacular, including the original 1856 Kyneton Hospital, the Malmesbury Viaduct, and the soft curves of the expansion to Kyneton District Hospital adjacent.
1 minute remaining.
Thank you. The Art Staff Pavilion is orientated to Caroline Chisholm Drive and helps not only enhance the new identity, but also helps reduce the visual bulk of the west elevation. A simple materiality strategy was adopted, with the pavilions being clad in either ubiquitous brick or farm shed colorbond metal. Off-the-shelf sill bricks have been used to create subtle shadowing and texture across the facade. The horizontal black line allows for a zone of active sun shading to the west, with gold-tinted glazing that deliberately reflects its surroundings. The gold glass references back to the previous life of Kyneton as a service town for prospectors on the way to the goldfields. The arch form then translates into a metal-clad motif for the consulting and community pavilions. The digitised version of the arch takes cues from the bluestone detailing of numerous local buildings. The 2 distinct versions of the arch establishes a new identity for Sunbury and Cobaw Community Health and continues their much needed community service to the Shire. Thank you.